Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am joined by Alana Dixon, the 2S LGBTQ plus system navigator, and Celeste Turner, the 2S LGBTQ plus support coordinator from Niagara Falls Community Health Centre located in Niagara Falls, Ontario. Through the Systems Navigation Access and Partnership Project, also known as the SNAP project, CHCs are increasing efforts to improve health and social systems navigation access to strengthen Canada's healthcare landscape and eliminate health disparities while improving population health outcomes. How are you both doing today?
Doing good.
Good.
Thanks for having us.
Of course, no, thank you. I'm really excited to dive into more about the SNAP project. And fitting, I am going to try to get this out in advance, but it is Pride weekend here in Toronto and Ontario. So this like serendipitous timing. I honestly didn't plan for it to be this way, but very, very nice timing. So Alana, I'll start with you. If you could tell us a bit about Niagara Falls Community Health Centre, the community that you're serving, and the programs that the CHC offers.
For sure. Niagara Falls Community Health Centre, or NFCHC, because that is a mouthful to say the whole name. We're, as you already touched on, we're a nonprofit, team-based, holistic health center that's a one-stop shop for many types of healthcare. So instead of having to travel to multiple locations for different types of appointments, much of it is streamlined here under one roof. So we have a primary care team that includes physicians and nurses, dietitians, a kinesiologist, occupational therapist. We've got a dental team, counselors, social workers, refugee outreach workers, and a 2S LGBTQ plus support team, which is currently Celeste and myself. And some of the programs that we offer here range from birth certificate and gender affirming ID clinics, workshops on boundaries, coping with stress and anxiety, heart and lung health, to art journaling, meditation, drum circles, and so many more programs in between. That's just like a little taste.
That's amazing. That's very, very fulsome and wholesome, which is what we love about CHCs and wraparound care. Celeste, did you have anything that you wanted to add in terms of stuff about the NFCHC, which we love an acronym in this role, in this job? We love an acronym.
I wish NFCHC made a cute, like a noise, like if you tried to say it like a word, but it doesn't. Like NFCHC is, like CHC is catch, right? Like sounds nice, but yeah, there's no vowel. So I think I think you did a really great job summarizing that. I think something maybe that's worth mentioning is maybe kind of unique or important, especially in Niagara, is that Niagara is this funky combo of like rural and like baby urban compared to, bigger centers like Toronto. And that like services can be very siloed. Transportation is a big challenge in our region. And so being able to offer so many diverse programs and services under one roof or, under one agency is so crucial and important for the population that we serve. So just that's another big piece around access is like, yes, we do a lot of things, and thank goodness that you can get all of that in one bus ticket or whatever the case is for somebody. And Alana, did you talk about the Care for Kids program? Did you mention that?
No, okay. That's new. So thank you.
Yeah, no problem. I'm like going through the list in my head and I can't recall if you said it, but yeah, so just
I missed that.
Recently we've received funding as well for the Care for Kids program. So we are serving like children, babies under 5 years old that don't have primary care can access us for walk-in clinic and for like baby visits and things like that if they don't have their own primary care elsewhere. And that also comes with a whole gamut of programming. There's a specific outreach worker that helps them, that serves them. There's a specific dietitian for them who supports with like lactation and nutrition and all that really important stuff, especially for young folks, for babies. So that's I think our newest and exciting program we have going on here. So
that's awesome. Amazing. So as we previously mentioned, NFCHC has received some SNAP project funding, and all of the projects are at various stages. So I used to say it's well underway, but some people have completed. So if you both could tell us a little bit about what has been achieved so far and what kind of impact your specific project has been having? And also like, what is the project?
Yeah, for sure. So the project is essentially, I mean, it's very broad, but the capacity that I've been brought on has been in a adding to the LGBTQ plus support that Celeste has been offering solo here for over 5 years. I did my student placement with them, and just seeing the scope of what they do, like so many different things, so many needs. So I am able to kind of now be a part of, now we have a team. So I'm able to help support Celeste in being able to provide better and more support to the folks that need help with accessing healthcare, gender affirming professionals in any capacity, or like being connected to resources and services that they're not aware of or have a hard time doing on their own for so many different reasons, which we'll probably get into a little bit later. And so I have the numbers in front of me, so I'll start with those ones. Our data specialist pulled some numbers for us recently. So this is from the start of the project, which was I started in August, middle of August, until the end of May, as that's the most recent data we're currently able to pull. But so from then until the end of May, we have booked 765 appointments, served 112 clients, connected 82 clients to different services and resources, administered 225 referrals, and held 38 different group sessions with 354 people in total attendance. And those are just, I was like, there's so many other numbers too, but like that gets kind of boring and whatever. But like those are kind of like the big main ones that I wanted to highlight that we've been able to touch on. And Celeste, I didn't tell you this, but I'm going to read some anonymous quotes from some of our clients that we have collected from so they're, as part of the SNAP project, we've been given like a client feedback questionnaire to get feedback. And these are like based on these specific questions from that on the services that we provide. And then we've added a part to just for people to share a bit about their stories and experiences. And I'm giving this disclaimer because a lot of them mention Celeste, and I know that makes them uncomfortable. but the impact that they've made, and now that I'm thankfully able to contribute to by extension, has really been monumental in so many people's lives. And I think it really demonstrates the need for LGBTQ plus specific support in navigating healthcare and other government services. So I'm just going to read like some short little excerpts of quotes here, but here we go. Before I met Celeste, I was overwhelmed with the process of my name and gender change. Celeste supported me with time, resources, knowledge, and comfort. They were the only person to turn that process into something manageable. There aren't many resources like that available. If there were more government workers like Celeste, I think I'd be having a much better time here in Canada. Here's another one. I'm most certainly very grateful for the support I received from NFCHC. The trans care I was able to get from Celeste and the NFCHC allowed me to remain in my home. I had been advised by doctors and workers for years to move to a bigger city that had trans care available until I learned about the services available at NFCHC. So that's like a myth included in there too, that you can't access that outside of large cities. I've been abused by the medical system. When I came to NFCHC, they treat me normal. The LGBTQ plus system navigators listen to me and are there for me. This is a safe space. That's priceless. I'm going to read one more. And there are so many more too. It was hard to choose and narrow them down, but having access to a support worker like Celeste has made a drastic material impact on my life. Without them, my ability to interface with the services I need access to in order to improve my mental and physical health would be virtually non-existent. Their help has been transformative. So that's just a little taste of the impact of what we've been doing here.
It's not often that I almost cry on my own podcast, but it like every once a year I get one emotional one, but that's so wonderful to hear and so amazing. And if I was you, I would be choking up because I am on my own regard, but it is absolutely such important work that is being done. And as someone who's like part of the queer community, seeing the CHC's work on the other side, I can't imagine what it's like to be able to be affirmed in that way by someone like yourselves. That's wonderful. Celeste, do you want to say anything before we keep going? Or are you like just cruising?
Yeah. No, for sure. Yeah, I think yeah, like it's emotional to hear that stuff. And then I also immediately, my brain's like, and there's more to do. Like, it's just, I'll never be satisfied with, you know, there's like, I say every day, or I think every day, and I say often, like every day my goal is to work myself out of a job. Like, I don't want this job to be necessary. I love my job, don't get me wrong, and I'm honored to do it, but like, I just, you know, I say that like when I retire, I'd like them to just, whoever, to be like, oh, we don't need to replace you, like we're good. Like we're done. Like, you know, queer trans folks totally have equity and your job's like totally obsolete now, and that's great. And so I know that's optimistic. And yeah, but it's yeah, it's powerful. It's powerful work for sure. And it's yeah, it's a lot, definitely. And to play this game, Alana, I have one I'll pull for you. It says Alana is fun, creative, and engaging when facilitating youth groups. She is caring and funny, and my daughter really enjoys spending time with her. So I think, you know, a really important piece about this is the fact that people are able to, you know, it sounds like there's lots of comments about me, but that's because having Alana has freed me up so much that, you know, I used to say all the time, like, if I could just cut myself in half and then like morph into two functioning humans, that would be great. And then I could probably do that 2 or 3 more times to be able to do all the work that needs to be done. And so having Alana to support with like co-facilitating groups and helping me plan things and or planning her own things and running things, like it's just been it's been incredible to be able to like expand the support that we offer. And even Alana has taken on like facilitating some programs that are newer to the CHC as well. So we've had a lot of Niagara Falls in particular has had a huge influx of refugees in the last while. And so Alana's been able to like take that intersectionality of 2S LGBTQ plus and you know, newcomer refugee population and have specific programming for that, which is something that I don't know if not that I would have maybe never done that, but like I wouldn't have had capacity probably, or it would have been really hard to add that to everything that's already going on. And so to be able to offer that has been incredible and so impactful and important. And so I don't want to imagine what we couldn't have done without the funding that we've received for the SNAP project, and by having Alana having an additional staff person and taking that work on, for sure.
And all of this is segueing and perfectly into my next questions, but I do think it's sort of obvious, but I will ask why it was important to develop these social prescribing tools specific to the 2S LGBTQ plus community, in case someone so far hasn't figured out why
you're right.
So important to do.
Yeah, so we've already touched on it a bit too, but to spell it out a little more obviously in the face, unfortunately those of us in the 2S LGBTQ plus community, especially those who identify as trans or gender non-conforming, face so many additional barriers in relation to navigating the healthcare system and getting the necessary support, or even just being treated with dignity as a human being, like trying to access services. The social stigma and discrimination that's faced from so many, from religious institutions to education systems, employment, government, healthcare systems, all of these things results in poorer mental health overall, in addition to having to navigate those extra barriers to getting the needed help and supports that this shouldn't be a thing.
Absolutely. I think that spells it out very obviously. And I'm sorry if you're in the background, my cat is fighting something. And I did say that this might happen. So I'm glad they've taken social cues. I want to add another question that I think is going to tie into the fourth question about challenges that when you're trying to implement, the system navigation tools and how these were addressed, but also we did another episode with Island Sexual Health, and they were doing some somewhat similar work out in BC. And I asked them as gently as I could. Obviously, we're seeing a lot of cutbacks and setbacks financially as we continue to have, I believe, this is a personal statement and not necessarily a work statement, that our governments are continuously sort of cutting back on the rights of the queer community, of trans care, gender affirming care. And so I believe that not only was this funding important because it just generally is in terms of community health centers needing money, but it does seem to me that there's also all of these pullbacks to just general equity for the queer community. So I'm curious, in terms of the challenges that you've had implementing the tools and how these were addressed, if there's anything you'd like to say about any of those types of setbacks as well to your just general role before there was a systems navigator.
Celeste,
sure.
I feel like you've got stories ready to go.
So yeah, I mean, we know that I certainly agree with you, and I think I'll also say that's a personal statement, but I think my organization wouldn't deny that either. Mm-hmm. That's, we see that loud and clear. I do a lot of talks around education and history for 2S LGBTQ plus community. And unfortunately, in the last while, I've added, talking about the rights that we've won and the historical changes. And now I've had to add to that training, and none of this is set in stone. And that's terrifying. This could change. We now more than ever, if there's people that are really amazing allies, and then people that are really, hateful, and whatever insert terrible word you want to use to describe that kind of hate and harm that's being caused. Anyone who's kind of been waffling in the middle, we really need you to pick a side. And I really hope it's this one. I really hope you're with us and it's allyship, because we do know that, that's getting more and more polarized, and that, unfortunately, some of the negative information or misinformation that's out there is getting louder. And so we need to make sure that our politicians are hearing, actually what is needed by and for queer and trans communities. Nothing for us without us, or nothing about us without us, and that needs to be part of it. And that's something have seen the entire time. I've been doing this work about 5 years, and for example, who makes decisions about what funding is available for queer and trans folks for gender affirming surgeries, and what surgeries are considered necessary versus cosmetic. Who is making those decisions, right? It's not queer and trans folks who are deciding that, and that has a direct impact on queer and trans folks. And then it just gets more and more complicated when we think about things we know that employment rates are lower for queer and trans folks, that there's an income disparity for queer and trans folks. It's just gets more and more challenging. The systems of oppression, they're just so complexly layered. So yeah, I definitely hear you. I think it's a really important piece that needs to be considered in politics with decision makers, and we all have a role of advocacy, even if we don't think that we do. Everybody can do something towards moving the needle in the right direction. So yeah, and then on that note too, with funding or services are potentially being cut or have been cut, it's one thing to find a service. It's one thing, just as a Canadian, to navigate our health system, social welfare system. Navigating all those things is complicated on its own. Being queer and or trans adds, I always call it the rainbow layer of complexity to navigating that. Yes, here's this free mental health service. I can't promise your therapist isn't going to be transphobic. I don't know, sorry. Or to be I do know this person's not transphobic, but it's a private practice, and I don't know if you have benefits. No, you don't. Okay, well, trying to navigate that kind of stuff, it's so complicated, and I think is a big challenge to implementing our navigation tools. Is one thing, is just, it's all complex, and I don't want to break trust and send someone somewhere that they're not going to be safe, or they're not going to receive the services that they need. It's not going to be trauma informed, and I don't want to perpetuate harm, and I'm part of the healthcare system, and so that's a huge responsibility that I take seriously. And I think another thing that's complex too is this stuff is ever evolving. It's always changing. Funding is pulled, funding is added. This program's available, this program's not available, this program's time limited. The eligibility criteria change for this program. Like, it's all so much to keep track of, and it's so hard to be able to implement when it comes to system navigation and tools that we're creating. So yeah, I think there's importance to like living documents and like keeping them updated and just like continually changing that and doing that, and it's it's really, really difficult. And like, here's 2 full-time staff people dedicated to that work. Right, like that's how complicated it is, just for Niagara, just for our little CHC, right? So yeah.
Yeah, absolutely. Everything you described about health navigation, it's hard when you're someone working the job who maybe doesn't have as many issues to have to navigate. Like, just it took me 6 years to get a family doctor, and I'm just a normal Torontonian. So it's like it's very, very difficult to navigate. And I can't imagine how much harder it is the more maybe specialized care that you're looking for. And just to keep up with all the funding and everything it is a sort of a living nightmare of a headache. But I really appreciate your perspective on that, and taking my random question, because I do think it's really important to highlight that these things are evolving and changing, not necessarily in a positive way, and that it is important to consider. Alana, did you want to add anything before we pivot to the successes and the joys and the happiness?
Another, I mean, this is a separate point from what Celeste shared, but like part of the SNAP project too that we have been doing and wanting to implement is starting a like LGBTQ plus peer support program. And that has been a challenge in getting started and realizing that like how many formalities are involved in that, and like little steps, and like can't just be like, hey, come and join us. It was like there's a whole lot involved to that. So that's definitely taken longer than I think we anticipated, but it is happening. It's slowly rolling out, and I'm excited about what that's going to look like to again like expand the work that we're doing and share that, and see. I'm hoping that it will lead to more growing and building. We'll see.
Amazing. And so, yes, the successes as well that you have been able to encounter through this project. I think all those testimonials clearly highlight that there are some amazing successes going on. So if I could hear more positivity and why these projects are so important.
Yeah, for sure. I mean, I feel like we haven't even talked much about like what our day-to-day looks like, but successes as far as like supporting clients who don't have family members or need somebody else to like understands them to accompany them to medical appointments, and like be an advocate for them when they're overwhelmed, or like we just ran this group called Transcendent Families that was like a 7-week program for parents or caregivers of trans and gender nonconforming youth, and it was such a beautiful thing. So it was split up, so the caregivers, adults, were in one group doing things like learning, being educated more, and giving more tools and resources for how to better understand their child, while creating community and kind of crowdsourcing together. Celeste, if you want to add any more to the adult group, because I was facilitating the youth group.
For sure. Yeah. I mean, this group of adults who just were so like committed to caring for and loving their trans youth, and then being like, and please help me, like, and I don't know what this word means. What do we do about this? What's the best way forward? What's going to be the least harmful scenario? Or you know what I mean? Like, personally, it was like super healing to see caring adults like care about their youth like that and be committed to that. And it was just so impactful. Like, it's the first time any kind of group like that has run in our region. I think the next closest ones have been like Hamilton, Toronto, that were able to provide this specific structured parents in one group, youth go to a different group, and combine that together. And yeah, I mean, the feedback we got from parents was just that they're like, we've needed this. There wasn't anything for us. And for them to like not feel so isolated in their experience and to be sitting in a room and facing other parents that are like having the same anxieties and fears and love for their kid and like just needing that support and navigating it. It was so like humanizing and wholesome to experience that with yeah, facilitating the parent caregivers group for sure. Mm-hmm.
That is super wholesome. That would be very, very healing for I'm sure many different people, but that's absolutely wonderful. So very important question. Does your community health center hope and have plans to sustain having a system navigator after the project sort of wraps up?
Well, so this project wraps up at the end of July, I believe. And thankfully, funds have been allocated to extend my position until the end of May next year, or June, one of those next year, which is great. So hopefully, so that is the short-term plan, and hopefully that will only be the beginning.
Amazing. I definitely can see that there's a need for, as Celeste said, about 5 of you. So hopefully past May and June of 2025, which doesn't sound like a real year, but on into the 2030s would be amazing at minimum. So we always tend to wrap the episodes with this final-ish question because I think that it's really important to hear. And it does lean into sort of what we're talking about politics and about sustained funding. But what would increased federal or provincial investment allow for NFCHC to achieve, and how would it directly impact the SNAP project? And let Alana stay till 2030.
Celeste, do you want to jump in?
Sure. Yeah. So I think that, we're doing the best work and the most work possible with the resources that we have. And so having more resources would only allow us to expand and do that. Like I would love to see, for us, if we provide gender affirming care, but it's only to our primary care patients. And we've been full for quite a while. Not taking new patients, and that's really challenging. And part of our roles still is helping people navigate that and finding care, even if it's not within our own walls. Like we'll still navigate and help people figure that out wherever in Niagara. But to be able to be like, yep, come on in, like we have, a part of our primary care team is like specifically allocated to just this care, or we also have, a mentorship program where family doctors can come and learn about this care, because it's, as much as we're calling it a specialty, it's not really a specialty. Any doctor NP can take on the, education and information needed to be able to provide this care within their own office. And unfortunately, again, in Niagara, we have this unique, I think maybe not unique to Niagara, but especially in Niagara, this challenge of just having a family doctor is a bit of a miracle, or having a nurse practitioner, or having a primary care provider is already hard enough to come by. And then to be able to come by one that is willing and trained, or has done the education or done their homework around providing gender affirming care is really, really rare and very few and far between. So having specific funding where we could take on that capacity and do that within our own walls would be incredible for us to be able to do that, and would fill a huge gap that exists in Niagara. We know, we have our neighbors, Quest CHC and St. Catharines. They do incredible work, and they're bursting at the seams as well. Like there's still folks that are needing care. They always have a wait list. And I also, I'm sure they're doing their best 100%. We love partnering with them. Actually, we should mention that family partnership. Yeah, with Quest Community Health Center. So we're really fortunate to have such awesome partners and like-minded partners in the region. And there's still so many people who need service and need care who can't access it, or are waiting on giant wait lists, or are moving to Toronto or elsewhere to be able to access care that they should be able to get in their own home community, wherever they want to live. So I think being able to take on that like beast of gender affirming care really, really well, and specifically and structured here would be incredible. And then also, having more staff dedicated to, keeping up with social prescribing, and having databases and resources and updating them frequently, and having those tools readily available would also just help us to like bolster the support we're providing to our patients, to be able to refer them to, we know health is more complicated than just primary care, and even more complicated than just gender affirming care, that also to be able to, if we had specific staff that was like, queer trans specific counseling, and we knew that, that's their role and that's the community they serve, would be incredible. Really any additional services would be amazing, because again, we know it's so hard to navigate, yes, within our own walls, but then especially even outside of that as well. So
absolutely.
Those are just some ideas off the top of their head.
Just a few thoughts.
Just a few. To get started.
Quest is a member of us as well. So shout out to them, because we've connected at the Alliance conference. And I mean, all the community health centers, the reason it's so great to ask that question, but also so not great to ask that question, is every single community health center needs so much investment and so much money, because there are so many people that they are taking care of, to take the burden off of hospitals and the typical sort of more siloed healthcare approach. And so it's been it's difficult to navigate for sure when you could be taking on so many more people. I want to thank you both so much for this absolutely wonderful episode, and for the amazing work that you're doing in Niagara Falls. It's clearly pivotal and important, and I hope that through some way or another we get Ilana to stay longer, and we find even more of lovely people like you able to care for the 2S LGBTQ plus communities in Niagara Falls and beyond. And I'm sure like all the other clients that are also being supported at that CHC. If anyone else wanted to learn more about the amazing work that you are doing over in Niagara Falls, where online would they go to learn more?
Yeah, so the most comprehensive information can be found on our website, nfchc.ca. But you can also follow us on Instagram or Facebook for program services and updates. Our Instagram handle is, so Instagram and Facebook are different. So Instagram handle is Niagara Falls CHC, and on Facebook it's our whole name, so Niagara Falls Community Health Center.
Perfect. When this episode goes out, both those places will be tagged, so hopefully people will be able to see it however they find this episode. And I usually display stuff on the screen at the same time because technology is amazing. Ilana and Celeste, thank you both so much for taking the time to chat today, and keep doing this amazing work. I'm excited to see like the wrap up of the SNAP project, but clearly this is going to keep going on, and that's very exciting to hear. So thank you both so much.
Thank you.
Awesome. Yeah, thanks for this opportunity, this one, and largely as well from CACHC. Super appreciate it.
Yeah,
our pleasure. Thank you. Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.